Figures from the Ministry of Health indicate that 62% of the 2,649 COVID-19 fresh infections in the first 17 days of this year of 2021 were found in Kigali, and that more than 80% of the 50 people the pandemic has killed this year were Kigali residents. In general, 4 of the 5 people COVID has killed in Rwanda so far were from Kigali City. The Rwanda Biomedical Center has also announced that in less than 2 months, the rate of new COVID-19 infections has increased so sharply, the prevalence of the virus has shot from 1 to 5% countrywide. And in Kigali City, it sits at 12%, meaning 1 in every 10 people in the city is carrying the virus.
Twapimye abantu basaga 2,900 mu gihe cy'iminsi nk'ine cyangwa 5 mu gihugu hose.
We tested more than 2,900 people in a period of 4 or 5 days countrywide, and back in September, we found the COVID-19 prevalence rate was at 0.1%. In October, it was at 0%. In November, it had gone up to 1%. In December, as the holiday season approached, we found the prevalence rate even higher at 2%. And that is when we started getting worried, because anything higher than 1% means something is very wrong. In January, during the first week, it had climbed to 3%. And this was random testing. 2 days ago, we found the figures at 5%, and this is the first time we are announcing this. That is countrywide. In Kigali City alone, it's 12%, and that is random testing. This is very worrying when you consider that it is random testing.
Ni ikintu ubundi kidasanzwe mu Rwanda ko dutomboza dutya tukabona abantu benshi bafite uburwayi bungana gutyo.
2 weeks after our hospital was opened specifically to care for the worst affected by the COVID-19 virus, critically ill that is, it is now 70% full. If nothing is done, it will be full in another week and another will have to be opened. Kigali's residents are worried, and rightfully so. Scary with so many people getting infected and dying. We used to say that COVID doesn't kill that much, but that is obviously not the case. I think a total lockdown should be imposed, but things like rent and garbage collection fees should also be suspended. COVID is a very serious problem because the infection rates have continued to climb, and so have fatalities. Our businesses have also suffered because of COVID. With so many infections and deaths, I think measures including a total lockdown for the next 2 weeks should be considered, but afterwards they should let us work again. Health officials have noted that movement restrictions are key if the pandemic is to be brought under any sort of control. It's hard to say that there is an area that is free of COVID. But if the prevalence rate in Kigali is at 12%, yet below 3% in the provinces, and an average of 5% countrywide, then Kigali is unique in many serious ways. It is therefore best that all people remain where they are so that health officials can properly deal with this. It is not the same if everybody is running around infecting others and pulling up the infection rate. Nyarugenge Hospital was opened 2 weeks ago and is already 70% full. Yet that is a big hospital. At this rate, we would have to open a new hospital every 2 weeks, which is not practical. Restricting movements for a certain period is far more doable as health workers continue their work. COVID-19 has so far killed more than 140 people in Rwanda since March last year, infecting more than 11,000.